Good afternoon, everybody. This is Dr. Mike Talbot here at UK Mediation, ready to present our webinar this afternoon on how to use mediation to resolve complaints in housing, healthcare and higher education. So you're very welcome to join us today. We have people from the UK and around the world, a great number of friends, old and new, who are joining us today to hear about how we can use mediation to bring about more positive resolution to complaints in these three very important areas. So housing, healthcare and higher education are three of the areas that UK Mediation has worked in a lot over the last 21 years since we began. And a quick word about me. I started the company 21 years ago. I'm a psychotherapist by trade and got interested in conflict by doing organisational consultancy, particularly around mental health in the workplace stress and how conflict contributes to mental ill health. So my particular angle on looking at conflict resolution and more positive ways to bring about resolution to conflicts and complaints is from the point of view of the psychology of conflict, what it is about conflict that's so difficult, why we get stuck there, and what it is we need to move on when we get entrenched into very difficult conflict or very protracted complaints. So today I'll be talking for about 40 minutes and there'll be time at the end for Q&A, but do please feel free as we go along to make comments in the chat box that you can see over on the right of your screen if you're watching this live. If you're watching it on the recording, you missed your chance, but if you are here with us right now on Friday afternoon, then your chance to make comments and questions as we go along, and I'll do my best to answer them. So for today, here's what we're going to be doing. I want to talk about what a complaint is. What do we mean by that? Sounds a bit obvious, but I think it's an important aspect of mediation is thinking about where it applies and where it doesn't necessarily apply. So we perhaps need to have a nice clean definition about what a complaint is, and then in particular the kinds of complaints that these three sectors face: housing, higher education and health. We've got a little video example which comes from a health service complaint. And this is an example of a young mum who's got an issue with the care that's been delivered to her daughter while she's in hospital, and we'll see the sort of drama of how a complaint might begin and how it might unfold, especially in terms of the interpersonal exchange between the complainant, the mum in this case, and the person who's there as the face of the organisation that she's complaining against. Then we'll talk about how we use mediation in these areas, what we can do to use mediation to resolve these kind of complaints, and then, like I say, a bit of a Q&A at the end, but a time will be left for that. So just having a look at who's here. We have friends from higher education, some of whom we've worked with, some of whom are new to us, some people from health trusts, NHS trusts that we do a lot of work with, and some friends from housing associations as well. And a great number of individuals, some of whom we've trained in mediation, I notice, and some of whom are new to us. You're all very welcome to join us for our webinar today. So let's kick off with a definition of complaints. Thinking about what is a complaint? Well, really it's some expression of dissatisfaction from a service user or customer, usually relating to the provision of goods or services. So it's somebody complaining about the thing they bought, the thing they were provided with, or the service that they were given. And often it's not just down to the concrete facts of what happened or perceptions of what happened, but quite often whenever we come across these kinds of complaint scenarios as mediators, there's an element in protracting a complaint to do with how somebody feels they were treated. It was the way they were spoken to. It was the communication they didn't get, it was the tone or manner of the communication, or it was the response they got when they rang up to try and sort something out. It can occur in almost any sector, and we do find, particularly in the current environment of COVID-19, there are things that people have found dissatisfying before the pandemic, but now in the pandemic everything seems amplified, and we're getting complaints from every single sector. Often to do with, again, the response they feel they've got from the organisation or individual they're complaining against, but it can happen in the private sector as well as in local authorities, as well as in the three sectors that we're talking about today. So what normally happens with complaints? Well, normally, most complaints can be resolved quickly and easily. So individuals who are well trained in taking complaints can normally handle things with a chat, and things can be sorted out there on the telephone or with a brief email exchange. So you get to voice your complaints, you get a good listening to from the person handling your complaint, you are clear about what you want, they're able to satisfy your needs, the situation is resolved and it goes away. So in terms of goods and services, quite often this is to do with a refund or a replacement of goods might be offered, a service is redone, or a situation is rectified in terms of redoing a piece of work. An apology is often provided, so an acceptance on the part of the service provider or the person who's provided the faulty goods or services that wrong has been done, that a mistake has been made. And quite often, if it's handled well, the organisation gets a chance to explain what has happened, as well as the complainant getting satisfaction for their complaint. So I think it's the more satisfying resolution of complaints is where both sides get to put their side of the story. We do quite a lot of work with police services where in the old style complaint processes, it would be about getting a letter from the Chief Constable to say, the constabulary apologises, and on behalf of XYZ constabulary, we're sorry that this happened and we'll make sure it doesn't happen again. It's not very satisfactory to anybody, but if you can have more of a restorative process, the kind of thing we're talking about with mediation, where both sides get to explain their actions, get to explain what underlay the words and actions that gave rise to the dissatisfaction, it's a far more satisfactory situation for both sides. Actually, it's a lot quicker, and actually it future-proofs that relationship so that any further dissatisfaction can be dealt with more quickly and more satisfactorily. So good resolution means both sides get a chance to say their piece. So that's the ways that complaints can normally be handled. I just want to dwell briefly on the apology thing. The apology is a whole range of exchanges between individuals. It doesn't have to include the word sorry. And one of the myths and legends about mediation, particularly in this sort of area, is about getting the person complained against to apologise. And quite often what we come across is that an organisation has already said sorry, but it was the way they said it, the manner in which it was delivered to the individual who's complaining, and the lack of sincerity behind the apology that has given rise to an escalation of the complaint. So the way we think about this is that actually you can make a more heartfelt, more sincere and more effective apology even without saying the word sorry if you acknowledge three things. Now, an apology really is an acceptance that the individual or organisation has done something wrong. It's an acknowledgement and an empathic statement about the damage or hurt that's been caused by their actions or inactions, and it's an assurance that this thing won't happen again. And I think when you get that very sincerely from an organisation, so the acceptance, the acknowledgement of impact and the assurance it's not going to happen again, this is quite often more powerful than a flippant, yeah, sorry, or we're sorry you felt that way, or yeah, the constabulary is sorry for the hurt that's been caused. Those things don't land very well usually, but that more heartfelt and sincere acceptance, acknowledgement and assurance tends to go a lot further. So just a little aside there about the apology and what it means. So this is how complaints are normally handled and resolved, but if a complaint isn't resolved, what tends to happen is that communication starts to break down. You get into a situation where both sides feel they're not being listened to. So this is why I make that point just a minute ago, that successful resolution is where both sides get to have their say and to explain their motivations and imperatives. Because if the organisation or individual complained against feels they're not being listened to and that the complainant isn't taking on board their perspective, that can sometimes lead to a bad place, just as much as if the complainant feels they're not being listened to. But what can happen in the failure to resolve complaints is that we end up most commonly with a complainant feeling fobbed off or ignored, passed around from pillar to post. My own personal experience, I had a complaint about a large telecoms provider, let's say. And each time I contacted this person, it's like I was starting from scratch. Yeah, who are you? What's the phone number? And yeah, what's the address? And what's the complaint? And I probably explained it about 7 or 8 times. So of course you're going to get more and more riled by this, more and more impatient about this when you feel you've been fobbed off, passed around, or ignored. And what you do is you redouble your complaint, and it becomes something that could have been very simply fixed in the first instance. It turns into something rather bigger, and your complaint starts to be focused on the way that your complaint has been dealt with. So on the other side of the coin, that's sort of how the complainant might feel, but on the other side, the organisation might feel that the complainant is being demanding or unrealistic, including when some examples that I can think of where the organisation or individual complained against has actually offered the complainant what they want, and then the complainant redoubles their complaint and say, oh yeah, well actually on top of that I want this as well, and I want that as well, and I want the other as well. So they redouble their complaint, they add things onto their wish list, and from the organisation's point of view this becomes rather demanding and unrealistic. Okay, so then what happens? Well, what can happen is that if they've not done so already, people can resort to arbitration or to the court. So when I say arbitration, this might be resort to a professional body that represents a particular organisation or individual. So a lot of professional organisations will offer arbitration where they hear both sides and then apply some measure of fairness and reasonableness to the complaint and the response, look at precedent, look at what the law allows, think about how these kinds of complaints have been handled in the past, and gives a solution. So the local government ombudsman would be an example of that, where they're actually doing soft arbitration, I would say, a lot of the time. The independent police complaints organisations, plural, might be involved to arbitrate about a complaint, to look at where we are in terms of legalities, but also to look at, a judgment of fairness and reasonableness in terms of whether a complaint is justified, whether the response has been adequate, and then to make a judgment about what should happen in order to bring it to a close. So this is what we mean by arbitration. People sometimes miss that bit out, sometimes miss the whole bit out and go straight to court, or they might actually use the informal complaint processes before they go to the courts. But ultimately, if the complaint's not resolved by a conversation, by an email exchange, by the informal measures, what will happen is people resort to arbitration, as I mentioned, or they get into this litigious place where they're actually doing a small claim in the court, or worse. The other thing that happens, of course, is that the relationship between the complainant and the organisation or individual complained against tends to get spoiled. So communication breaks down, it tends to become quite personalised, it can become quite critical and persecutory between the two parties, and the relationship gets wrecked. What happens at that stage then is when we get all formal, when we get all litigious, this just gets in the way of good dialogue. So there ceases to be much chance that you're going to resolve it by talking, and the process ends up as being a winner and a loser. The person is either, David and Goliath situation quite often, either the organisation wins or the individual feels as if they've got a victory over Goliath because they've won and they've got what they wanted by way of the complaint. So that's the kind of thing we're talking about with complaints. That tends to be the ways that they get resolved, and that's what happens if complaints ultimately don't end up getting resolved satisfactorily. So let's think about the sorts of complaints that we have in these different sectors that we're talking about today. And we've only picked these 3 sectors partly because they all begin with H, no, just kidding, but because there seem to be very high numbers of complaints in these particular sectors. So we're talking about complaints against private companies, complaints in the housing sector, complaints against local authorities, councils. Healthcare is a very, very high number of complaints, not least the number of us who use healthcare services, particularly during the pandemic. So there tends to be a very high number, as there is as well with emergency services. And one of the other areas we're focusing on today is in higher education. So the 3 of these that we've picked out today to concentrate on are the healthcare, housing and higher education. So it tends to be NHS trusts, housing providers, particularly social housing providers, and higher education, the universities sector. So these are the 3 areas we are thinking about. So in time-honoured fashion with our webinars, let's have a think about some statistics. So just with some very recent figures, let's look at housing first. So in the housing sector, we have had just in the months between April and June this year, very recent report, there have been over 1,300 official complaints made to the Housing Ombudsman within these months. So this might be local authority housing, social housing in particular, where this number of complaints have been made. That's an enormous number of complaints, very high. The sort of things we're talking about are people having problems with repairs that are supposed to have been done by the housing provider, issues to do with rent arrears and how they're being collected, or particularly during the pandemic, the requirement that there be no evictions. There's been a bit of variability in how that law, a piece of legislation, has been applied. And of course, very unfortunately, there have been a lot of people who are in a position where for the first time in their lives they haven't been able to afford their rent, partly because they don't have a job anymore, and all sorts of unfortunate reasons as well. Other complaints from tenants and from individuals are about their housing provider not dealing with antisocial behaviour and neighbour nuisance. I've got ASB in quotes there because quite often we get inquiries, people talking about mediation to address antisocial behaviour when it's not really antisocial behaviour. It's labelled as such, but quite often it's just miscommunication between parties, or a difficulty in cultural issues, or issues across the age divide, or stuff to do with prejudice and bias. Not necessarily ASB, but it gets labelled as such, hence the quote. But people do often complain to their landlords and housing providers because they haven't dealt with issues of neighbour nuisance or inconsiderate behaviour on behalf of other tenants and disturbing their lives. And the other bits are of course around maintenance and cleaning, particularly of communal areas. So these are the kinds of things that people complain about in housing. They can also complain about the way that they were spoken to or dealt with when they made their complaint, or it can sometimes be a case of a real miscommunication, interpersonal fallout between two particular individuals, the tenant and the person who's got the job of answering the phone down at the local authority offices. So it can be more of a personal thing, as well as being a complaint about the actions of the housing provider. So that's housing. Second one to think about is health, and in this even larger figure, to about 28,500 patient complaints to the NHS, HCHS as it's called these days, Community Health Services, between October and December last year. So we actually checked this figure because it didn't look right, and it is right. That's an extraordinary high number of complaints to the organisation that deals with patient dissatisfaction, carer dissatisfaction, just in those 3 months in 2019. Staggering number of complaints there. There's over 9,000 a month. And in terms of the complaints in healthcare, the kinds of things that people are complaining about, it tends to be about something as basic as a wrong diagnosis or a failure to diagnose early enough, I understand, and also what tends to get labelled as medical negligence. So something that's not picked up, it's been treated incorrectly, misdiagnosed, a treatment that comes too late or that's inadequate, or courses of treatment that are not completed or are not monitored sufficiently carefully. The other thing is about disagreements over care decisions, which can include stuff to do with withdrawal of medical care and moving to palliative care only. And we know there have been some famous cases over that. And I'm pleased to say that mediation has an increasing role in these areas where there are problems to do with care decisions, particularly around continuing care, and where rather than go straight to the court, people are trying to encourage both sides, and I would say that both sides do often need some encouragement to walk towards mediation. And if they do, our own experience in the increasing amount of medical mediation that we do is that it can be very, very successful, really quite surprisingly so. The other thing people complain about is about cancellations and postponements. And again, with ICUs getting increasingly filled with COVID-19 patients at the moment, people's operations are getting pushed back. There's a continuing dialogue every week within NHS trusts about what operations can be prioritised, what can be postponed, what has to be put off indefinitely in order to keep ICU free for, at the moment, the burgeoning numbers of COVID-19 patients. And a key area as well for complaints in healthcare, which may relate to any of the above, is around a lack of communication. Around not being told that your operation is about to be cancelled, about a lack of contact between the medical professionals and the individual, about a failure to communicate some important piece of information. This can be a very common area of complaint within the healthcare sector. And then let's have a think about higher education. So in higher education, the body that deals with complaints is the Office for the Independent Adjudicator, or the OIA. And what universities try and do is they try and deal with complaints internally, strongly encouraged to do so by the OIA. And in fact, universities can be sanctioned if they don't deal sufficiently well with complaints internally and they pass too many up to the adjudicator. So universities strongly encouraged to deal with complaints internally themselves. But there has been an increase in 2019 in the number of complaints. And this is, bear in mind, this is pre-COVID. So 21% increase, so they've gone up by a fifth. Number of complaints that have gone into the OIA in 2019. That's up by nearly 2,500. And those figures come from the OIA. We've done some work with the OIA, incidentally, and with universities to look at how you can use mediation to nip complaints in the bud. One example was working with the University in Huddersfield to look at working with their registry to try and address complaints. And they got their rate of formal complaints down to almost zero at a time when in the sector the number of complaints was increasing nationally. So by using mediation, monitored and overseen by the registry at Huddersfield University, they got their number of complaints right down at a time when in HE complaints were going right up. They got a Times Educational Supplement, a TES award for the best registry that year on the back of the work that we did with them in using mediation to more constructively address their complaints through the registry. So it really works. We've got data to prove that it really works. And the kind of complaints we get in higher education can be about poor teaching, or a lack of teaching, or a lack of time that tutors and lecturers are providing to people. This can include undergraduates, postgrads, and in the case of particularly PhD students, we find it's about levels of support. So people complaining that their supervisors are not available to them, they haven't got enough time from their supervisors. There can also be complaints about student issues not being dealt with properly, where there are practical issues to do with assignments, or to do with the use of intranet, or to do with the use of portals, and stuff that's just not dealt with properly or quickly enough, and students can get upset about that. And more seriously, about allegations against staff, so more interpersonal issues to do with conduct, to do with the way a person feels they were spoken to, or the way they were dealt with by a particular individual. So all of these things are complaints that we have dealt with in higher education, not uncommon, and as we see, they've actually gone up, unfortunately gone up in the back end of 2019, have gone up by about a fifth. So they're the kind of complaints we get within those three sectors. And just to put a bit of flesh on the bones, we don't have enough time to provide examples of everything today, but what we can do is to provide you with a complaint, with an example rather of a medical complaint, which is what I'm going to do in a second. And just before I do, I'm pleased to see that you've taken my invitation to ask your questions or make your points as we go along. And we've got one here from Reese by email. Reese, thank you very much. Can mediation help resolve the complaints about student fees and online teaching that are happening with COVID? Yeah, very, very current issue, of course, Reese. And the short answer is yes. So we've had quite a few approaches now to do with what's happening with students being locked down in their halls, to do with the desperately unfortunate situation of freshers coming away from home for the first time, pitching up to universities all around the country, and then being told within some cases in about 2 or 3 days of arrival in their university towns that they're going to have to be locked down in their halls, and are understandably fed up and dissatisfied by that situation. So yeah, we've had quite a few calls about that, about how we deal with various situations there. And what we're seeing now, of course, is that students are saying, why am I paying £9,000 to be locked in my halls and doing online lectures? Also some stuff about COVID policies around universities, and also the availability of lecturers and other staff within the institution. So in short, yes, mediation can provide a perfect environment in which to have a more constructive conversation about what we can do, what both sides can do about this situation. And I think what we're seeing is that the staff at universities get a chance themselves as well to explain their predicament to the complainant, to the student or his or her parents who are complaining. And it's a very constructive dialogue that helps both sides. So it's not just about the complainant getting what they want, it's about the organisation complained against getting a chance to put their side of the story, and hopefully for a collaborative process to come about within the mediation, so that both sides can get their interests met, and that we can get far more constructive and mutually satisfying outcomes to such processes, rather than it just resulting in a sanction or a more litigious sort of win-lose type outcome. So thanks for that question, Reese, and again, you know, keep them coming. So now we move on to our example. We're going to give you an example from a complaint in a medical setting, and this is to do with the care that a young mum called Molly is complaining about the standards of care that have been provided to her daughter Lily, and we're going to see the setup just now between Molly, the young mum, and Joanna, who's the nurse in charge of Lily's care. And we're going to hear about some of Molly's concerns about that, and we'll see how this escalates. It's just to put a little bit of drama into the webinar, so you can see a very realistic example of how things can quickly escalate and the kinds of behaviours that people bring to bear in a complaint situation.
Molly is a single mum of 2 daughters, Lily 7 and Imogen 1. Lily has a long-term medical condition, which means that she has to have frequent hospital stays. During her current admission to hospital, Lily picked up a serious chest infection when on the ward and had to spend time in ICU. Molly's relationship with the medical team has deteriorated during this time. She is unhappy that Lily got the infection in the first place, but now that Lily is back on the regular ward, Molly has concerns for how she is being cared for.
Hi Molly, how's Lily? Is she settling back in okay?
Yeah, well, I'm still not happy with the level of care that she's receiving.
Why not?
Well, I left her before and she was complaining about how she'd been ignored all day. I leave her and she's in floods of tears. You're still not feeding her properly.
Molly, rest assured, she's in the best possible place. We're doing all we can to care for her.
But how can you say that? Because last time she was here, she got a chest infection and was sent to the ICU.
It's a very busy ward, Molly, with lots of very sick
Well,
children.
yeah, I know that, but on the ICU, she had one-to-one care being looked after by a band 6, and now she's back here. She's been fobbed off onto an HCA. Like, I used to work in this business. I know exactly what you're doing.
I know, Molly, and we've had the conversation about banding. On the ICU, there's a much higher ratio.
Yeah, but you need to be concentrating on my daughter's care. That isn't good enough. You concentrate on her getting better, not worse.
The ward's sister, Joanna, is having a regular catch-up with one of the consultants, Dr. James McIver.
We've got a new admission, a little boy with JRA coming in tomorrow evening, and then Lily, who's back up from ICU now.
Is the infection all cleared up now?
Yeah, she seems okay. I mean, we're keeping a close eye on her. She was having some difficulty with her breathing, but it seems to be settling down now. Yeah, I think she'll be okay.
Did you hear about, we had a bit of bother with her mum in the ward the other day?
No, I didn't hear.
Anisha was doing her rounds and she got a bit abusive with her and
Right.
a bit of a scene in front of the parent.
Okay. I mean, it's tricky. She's in a really difficult situation. You know, she's on her own. She's got the others to take care of as well. But, you know, she knows what's acceptable on the ward, so we can't let it go on.
No. Well, I did mention it to someone from Powell's, and they're of the opinion that it's reached the stage now where we're perhaps looking at a stage 1 warning with it.
Yeah, I mean, I suppose it probably has got that far. Okay, do you want me to speak to her next time she's in?
Yes, please.
Yeah, okay. All right, anything else, James?
No, I don't think so.
No? Okay, thanks.
Thanks a lot.
Oh, Molly, could I just have a quick word with you?
Yeah.
Thanks, just come and take a seat for a second. I understand there was a bit of an upset on the ward yesterday.
Yeah, all I was trying to do is explain that Lily's still not being fed properly and her oxygen's being done completely wrong.
Everyone is doing their best to care for Lily, but I need to balance your and Lily's needs against everybody on the ward. I understand that you shouted at Dr. Javid during her rounds yesterday. That upset some of the parents. Then you shouted at the parents. That upset some of the children. We really can't tolerate this kind of disruptive behaviour. Do you remember when you first came to the hospital and we gave you information about the acceptable behaviour policy, and the way that you're behaving currently is in breach of that policy? I really do need to ask you to stop. It's inappropriate, it's possibly unsafe, and it's actually getting in the way of us being able to deliver the best possible care for Lily.
Well, no, because have you not got anything else to worry about right now other than handing out warnings to me?
I understand you're upset, but the staff and parents on this ward are getting upset with your behaviour as well. It really does need to stop.
All you're trying to do is cover up the fact that you're not looking after my daughter properly. She's the most ill patient on this ward.
All the staff know about Lily's condition and are able to administer her treatment and feed. I can assure you that she's always allocated a nurse who is more than capable of looking after her.
That's not what you've shown me.
Molly, I need to make sure that you've listened to what I've said today. This is a stage 1 warning. I need to make sure that this isn't going to escalate any further, or we will need to take further action.
No, I'm not having this. This is absolutely ridiculous. What you should be doing is looking after my daughter, not this. Fuck's sake.
So there we go. There's the complaint from a young mum about how she feels the care is going for her daughter. And she is, from her point of view, quite understandably impatient and cross. As far as she's concerned, the hospital should be pulling out all the stops to provide the very best care for her daughter. And the mum is not really concerned about the situation of the trust and Joanna's team, who have a whole load of other people to look after as well. As far as the mum's concerned, you know, her daughter is the top priority. And as far as Joanna, the nurse there, is concerned, she's got a very limited resource and limited time, and also some standards of behaviour that the trust has to require of its service users. And we can clearly see there a case where it's begun to escalate, where there's a sense that the mum, Molly, has stepped over the line of acceptable behaviour, where the trust is going to have to take some action and do something about this. So in the bigger scenario with this one, this is just a very small clip from one of our training videos, and it goes on into a full-blown mediation between Joanna and Molly with an independent mediator who comes in from outside the trust to get these two together and to try and resolve that complaint, which is a good point to deal with our next question from Chris. Chris, thanks very much. He says, who pays for this mediation? So you asked your question at the time I was talking about higher education, Chris, but I guess the same question is quite pertinent in this case as well. It would tend to be the organisation who pays to bring in an external mediator, albeit that some of the work we've done over the last 21 years is setting up internal panels of mediators as well. So quite a few NHS trusts have their own trained mediators who can deal with the sort of everyday need for these resolution meetings based around mediation principles. So in short, within a trust or within a university, there might be trained mediators there who, if the parties are happy to do so, they can use the internal mediator to come and try and facilitate a resolution meeting between the two parties. But sometimes it needs to go up a level into a more structured mediation process involving an external mediator, and if there's a cost for that, it would tend to be the organisation that pays for it. Some might say, well, why shouldn't the complainant have to pay for it? Well, quite often the complainant wouldn't be prepared to do so, and it's definitely in the organisation's interest to bring about a quicker and more mutually satisfying resolution to the complaint, rather than have it escalate into formal processes. So a relatively small amount of money for a mediator compared to a relatively large amount of money if it went into a very litigious court-based process. So thanks for that question, Chris. So in short, the organisation. So let's have a think about where we go from here then, and into looking at complaints mediation itself. Let's have a think about some of the particular characteristics of that. So it's a way to bring about a better and more constructive conversation between people. It's a way that an impartial, independent third party will hear first individually from the two sides and then bring them together in a joint conversation and try and make that conversation to be constructive, future focused, based on people's underlying needs and interests, not to do with posturing and positions and who's right and who's wrong. The point about it is it will usually preclude any need for formal action such as arbitration or the courts, which I've mentioned can be lengthy, certainly very expensive in the case of courts. And often these processes will bring about a sense of somebody winning and somebody losing, but what we want with complaints mediation is to ensure that that's not the case. So we have this idea about a both gain situation. Both gain means that two parties walk away feeling as if they've achieved something and gained something from the conversation, rather than a sense that one was right and one was wrong. Also in complaints mediation, some essential underpinning principles. It's got to be voluntary. People can't be made to do it. They have to want to take part. It has to be private. Quite often people's behaviours are maybe not ideal. They wish they hadn't done or said something, or there are things they want to say to an individual in private. So we don't retain any record, and disclosures are minimal. It's really just in the case of risk issues, risk of harm, or sort of safeguarding type issues that we have to make disclosures. Otherwise, the disclosures are very minimal. And the third thing is it has to be future focused. So we're looking at not about who's to blame, who's right and who's wrong, but we're looking at the shared responsibility to improve the situation. So quite briefly, what the process involves is an independent mediator who meets both parties separately. And when I say independent mediator, if that's an external mediator, there is this greater perception with the individuals of that independence. If it's an internal mediator, there can be a bit of an issue there about whether the people perceive the mediator as being truly independent. But what we do is the mediator meets both parties separately and then thinks about how to get the conversation going, whether we should bring people face to face, whether we should shuttle between them, whether we do some work on the telephone, or of course at the moment during the pandemic, most of these mediations are going to be taking place online. We are doing face-to-face mediations if the circumstances can be created so that safety is paramount, but otherwise we're doing a lot of work online at the moment, which is great because we can work with people from anywhere around the world and in multiple locations around the UK, but there are some limitations to that, which we have addressed and talked about in our online mediation webinar that you'll find in our library of webinars on the website. So we decide how to get the conversation going, what's the best way to do it, and then within the mediation we encourage both sides to listen to each other, get their points across clearly, clarify what they want from each other, have a good dialogue, have a good exchange of views. It can be difficult, it can be heated, there can be a lot of emotion involved. The mediator's job is to ensure there's a fair negotiation, to ensure that people are able to make their points and that both sides get to hear and understand the other side's points, and that they have a fair negotiation and hopefully get to the point of an agreement where the mediator will help them to document that agreement, and usually to follow up as well, usually to get a review on these things to check whether the agreement has held up and whether the agreement has indeed brought about a satisfactory resolution. So that's very, very briefly the process by which we carry out the complaints mediation. In terms of how you would draw this down, how you would use mediation, I mean the success rate for complaints mediation, we've had a bit of a look around, some bits of research. Our percentage rate is probably a bit higher than that. I imagine some internal mediators, it may not be quite as high as that because there is this issue to do with perceptions of impartiality and so on, but give or take about 4 or 5 out of every cases will resolve successfully. Highly cost effective, so the cost of a single day mediation is a fraction of what it would cost you if you went down the litigious route, and especially if you're having to use lawyers and solicitors and barristers to take it through a more court-based process. Very quick, most mediations will conclude in a single day, and I think it's good for customer relations. So I think if you're a housing association or NHS trust or university who uses this far more positive, far more enabling and empowering way of solving your complaints rather than just getting the rule book out every time. I think it's very good for the organisation's image and kudos and culture. And I think having this sort of resolution focused culture is something that's really catching on, something we've been really promoting for the last 21 years. And I think to have mediation as a very early step in your complaints processes is good for the organisation as well as good for its service users and customers. How are you going to do it? Within these 3H settings, so within housing, healthcare and higher education, what we say are top tips. How you would make the most of mediation is offer it very early on. Don't wait until things go bad and until the wheel comes off. Try and offer mediation early on as a first remedy rather than a last resort, and not leave it until communication's broken down. Do insist it's voluntary. There's no way you're going to be able to frog march people into mediation, and people tend to resist being made to do something against their will. And our bitter experience is that if you, where we've seen people be forced into mediation, it simply doesn't work. There's very little that the mediator can do, and people are going to sit there very reluctant, arms folded, and not participate. So it has to be voluntary. There has to be an intention on both sides to make a situation better, and there's no way we can force people into it. And the last bit there that I've alluded to once or twice is about the impartiality. People don't want you to judge. They don't want you to take sides or tell them what to do. If they've come towards mediation, what they're after is this impartial third party to help the negotiation to happen. And so long as they're motivated to get in that kind of solution, we're in a good place. But we do need to stay impartial. Unless we're doing an arbitration or a more litigious or blame-focused process, we do have to have this neutrality. The way this works, we can have internal complaints mediators who work as part of a panel within a university or trust or housing provider who take referrals through an internal coordinator. There might be this issue with perceived bias where the service users or complainants feel that, yes, you've got a lanyard on from this NHS trust, so you're going to be biased in their favour. It's not usually the case, but there is that perception in the mind of the complainant. And internal complaints mediators might do just a few, maybe a handful of cases a year, and because of the relative inexperience and the relatively few cases they do, they'll very often work in pairs for mutual support. So one of the ways you can get access to mediation is by using the mediator who is internal to the trust or housing provider or university, and by way of contrast you might have an alternative of an external complaints mediator. So back to Chris's question, this would tend to be paid for by the organisation, who would come from an outside agency such as our own, who would have a lot more mediation experience, probably across a variety of sectors, and who would be a professional mediator who does a large number of cases. They would often work alone to keep costs down, and they would be on more of a pay-as-you-go basis, so you just pay them when you need them rather than retaining your own mediators. So there's a very quick skip in 42 minutes through how we can use mediation in these three sectors, housing, higher education and health, to bring about more positive, more future focused, more collaborative resolutions to complaints, giving both sides a chance to put their side of the story, giving everybody an opportunity to explain their own needs and imperatives with a relatively very cost effective way to bring about these more future focused solutions where you can actually strengthen the relationship between the complainant and the organisation complained against, rather than going to court and actually spoiling that relationship. A very quick skip through how mediation works in that setting and some options for how you might access it. That's a lot of the content for today's webinar, and if there are any comments or questions, we'll take those while I tell you about a couple of upcoming webinars. So in November we are looking at Time to Transform the Legal Profession. Why not have a contentious title to get people's attention? So we're looking at where mediation comes in as a complement, as an alternative to legal processes. So UK Mediation is an organisation not made up of lawyers or legal professionals for whom we have great respect, and we work in a complementary fashion to the legal profession. So we are people from a range of backgrounds, not legal bods, not lawyers or solicitors, barristers, etc. So we work in a rather different and rather complementary way to the legal profession, doing full-on pure mediation, not varieties of mediation that have now been taken on by solicitors and barristers. We are doing the sort of pure form of mediation, nothing to do with litigation or evaluation, or especially for those of you in the know, the last thing we do is evaluative settlement conferencing. We work in a way that's a million miles from that. So in November, I'll be talking about how mediation in its purest form provides a very complementary approach to what happens within the legal profession. And in December, we'll be talking about a bit more detail about building dialogue in a healthcare setting, about how to use the strengths and the techniques of mediation to promote dialogue in healthcare settings where there are problems, which could be complaints like we've been talking about today. It could be interpersonal disputes, it could be workplace type disputes, grievance type issues. Anywhere where there is conflict or complaints within a health service setting, we'll be looking in December at how you build dialogue within those settings as well. So a couple of nice comments coming in for our webinar today. Thank you very much for all of that. And we're close to finishing. So what I will say is do keep well, do stay safe, do watch out for our imminent tier 2 just around the corner. And we look forward to seeing you on our future webinars. Do keep in touch, please. You can like and subscribe our YouTube channel. You may be watching this on the recording. If you want to share with other people, you're very welcome to do that. You follow us on Twitter. Check us out on LinkedIn. We have I have a personal page there. We've got a UK Mediation account there as well. And check out our Facebook as well. Share and like. Thank you very much for watching, and we'll see you next time.